All right, we are going to finish the foot and ankle with going over special tests. So normally I demonstrate these tests. Obviously, we're not in a traditional classroom, so I am going to show you guys pictures, explain it as best as I can, and then I've also embedded videos in this slide presentation as well to help you have more of a visual on how to do them. So what are special tests? So special tests are just ways that we can assess the body part for potential injury. In no way is it the same as an x-ray or an MRI, but at least it can give you a general idea of what's going on. So you use special tests to see if there's ligament damage. You use special tests to see if there's more joint movement. You use special tests to check if there's any neurological deficits going on, like nerve damage. And then you also use special tests to check for any vascular issues. So if there's blood flow compromise, things like that. We're going to go over the special tests that are used for fractures. So the very first one is called the long bone compression test. So for this test, you're going to have your patient lying supine. So supine means that they are lying on their back. Prone means that they are lying on their stomach. As an examiner, so that would be you if you were testing someone, you would be standing in front of your patient's feet, and you're going to have to ask your patient to remove their shoes and also their socks. The action is going to be that you are grasping their metatarsal at the metatarsal head. So if you remember, your metatarsal heads are all closest to your toes. The base of a metatarsal is the one that's further away. It's kind of in the middle of your foot. And then once you've grasped that metatarsal head, you are going to apply an axial force down the length of the bone. So that probably doesn't make sense to you right now. Once I show you a picture and the video, it'll make sense, but just make sure you copy down that information right now. And as you can see in this picture, and no, this is not me. Every year students ask, but no, this is not me. But this person is examining somebody for potential metatarsal fracture. She is stabilizing just above the metatarsal, or I guess more proximal to the metatarsal head. And then she's applying a axial force. So what that means is she's pushing those bones downward. And so if you were to have a fracture, you're going to have pain because you're pushing those bones together. Your positive is going to be pain along the metatarsal shaft. So remember, the shaft of a bone is that long part of it. And then their pathology would be that they have a metatarsal fracture. I'll give you a moment to write that down, and then I will show you this video. And hopefully there aren't any ads.
The test we're going to perform is a long bone compression of the metatarsals. You're going to stabilize at the ankle, and you're going to line metatarsals up, and you're just going to press them together. A positive test would be pain along the length of the metatarsals.
All right, so he kind of goes over what I've already gone over, but you'll see he's just pushing the bones together. For our next special test, we have the tap test. So the tap test is with the patient lying supine. So they are laying on their back again. As the examiner, you would be standing in front of your patient's feet. Same thing, they need to take their shoes and socks off. And then your action, I do not have a video for this one, but you're just tapping at the end of the phalange. So you're just imagining that you are just tapping, not imagining, if you were to do it, you would be actually doing it, but you're just tapping the tip of their toe. And so you can kind of see in this image, there's a fracture right there. If you were to, let's say, just tap your finger up here at their toe, it's going to cause vibration in the bone, and that vibration is going to be painful. So if somebody were to have a fracture, they're going to say that they have pain in that spot. So your positive is going to be pain along the phalange, and then your pathology would be a phalangeal or phalangeal fracture. All right, next test that we have is the squeeze test. So your patient, again, is going to be lying supine. You are going to be adjacent to the injured leg. So what that means is you're just standing off to the side of it. Your hands are going to be cupped behind their tibia and fibula, and then you're just gently squeezing the tibia and fibula together, and you're progressing towards the site of pain. So if somebody has pain at their ankle, so let's say distal lower leg, you're going to start closer to the knee, so proximal, and work your way down. If it's opposite of that, you would start, if the injury has pain at the top, of their lower leg, so more proximal. You would start then at the ankle, which is distal, and work your way towards it. So you're just not wanting to start at the site of their pain or injury. So you'll see kind of in this image, if somebody is telling me that they have pain down here, I'm going to start squeezing up here and then work my way down. If they have pain up here, I would start down here and squeeze and work my way up. And the reason why is if you have an injury and you press on that injury, of course it's going to be painful. But if you're pressing away from it and it's still painful down there, then that's going to indicate that maybe something else is going on. So your positive would be pain. And then also you might feel a crepitus sensation, so that crunchiness that I've talked about before, and that could indicate potentially that bones are broken and they're kind of just crunching around each other. But your pathology would be a fibular fracture, or it could even indicate a syndesmosis sprain. So if you remember, syndesmosis sprains are high ankle sprains. It's when you actually sprain the ligament that holds these two bones together. So if you were to squeeze up here and you have a high ankle sprain, it's going to be painful as well. Bump test, so there will be a video that accompanies this one. For this one too, patient is going to be lying supine, so on their back. Examiner will be standing in front of their involved heel. You are then going to dorsiflex their ankle, so you're going to make sure they're bringing their foot back, and then you're just bumping the calcaneus. With the bump test, you'll see their foot is in dorsiflexion, so it's brought back, and then he is just pressing or bumping into their calcaneus or heel. Positive signs would be that there's pain and it's going to be specific to that area that you're bumping. And your pathology would be that there's a stress fracture of the talus or the lower leg. So if you remember, calcaneus is right here, talus is up here. If you are bumping right here in this bone, it's going to vibrate into the next bone, which would be the talus. So then if you have a fracture, that's going to be painful. And then let's say you don't have a fracture there, but you have one up here. Again, that vibration is just going to continue along that bone. So we'll show a little video. Sorry about the ad.
Hello everyone, Dr. Chris Fox here. Today we're going to take a look at the percussion test. Your patient is going to be in supine, and this test is used to assess for a potential fracture. You're going to take their shoe off on the tested side, and you're going to strike the bottom of their heel firmly 3 times. The test is positive.
So you'll see he mentions that the test is called the percussion test. I call it the pump test. It's also called the bump test. So just know if it's percussion bump, it's kind of the same thing. You also have special tests, obviously, for sprains. These ones are specific to the ligaments in the ankle. So the very first one is called the anterior drawer test. This test, you're going to have your patient sitting over the edge of the table with their knee flexed. So they're going to be sitting on an exam table. Their feet are not going to be touching the ground because the table is much higher than a normal chair. But their feet are just going to be dangling relaxed off the edge. Examiner, you would be sitting in front of your patient. You're going to have one hand just above their malleoli. So those 2 bony parts on the side of their ankle, you're going to have one hand above that, stabilizing. You will then have your second hand cupping their calcaneus or their heel and having their foot resting on your forearm. Your action is going to be, you will be moving the calcaneus and talus forward while this top hand is stabilizing the lower leg. So again, just write this down. It'll make more sense once I show you an image. So you'll see in this picture, this top hand is above the malleoli, stabilizing, and then this hand has the foot resting on the forearm. You're cupping the calcaneus and you're pulling that foot forward, kind of as if you're opening a drawer. Your positive is going to be increased translation of the talus. That's just a fancy way of saying your foot or the ankle joint is going to move forward, more so than the uninjured side. There might be a lack of end feel sensation, so the injured side might move more than the uninjured side, and then typically the patient is going to complain of pain. The pathology for this injury is going to be an anterior talofibular ligament sprain, and the reason why is your ATFL ligament is right here, And when you're pulling on it forward, you're essentially pulling on that ligament. So if you have a sprain, it's just stretching that sprain even more. And I'll show you this little video. Again, hopefully no ads. So you'll see this video has no sound. He is just pulling the foot forward as if he's opening a drawer. All right, next special test is the Taylor tilt test for inversion. So you have it for both eversion and inversion. This one is specific to inversion. Patient is going to, again, be lying supine, so on their back or sitting off the edge of the table. You will be then, as the examiner, in front of your patient. You're going to be doing a very similar not movements, but hand placement. So one hand is going to be grasping the calcaneus, and then the other hand is going to be stabilizing leg, again, above those malleoli. And then the action of this special test is you're going to be moving the foot into inversion. So again, if it doesn't make sense right now, the image will help you. So you'll see here, they're bringing the foot inward or into inversion. This one is testing specifically for a calcaneofibular ligament sprain. And so that ligament runs right here. So similar to the last test, when you're bringing the foot into inversion, you're essentially putting that ligament on stretch. So if there's a sprain, it's just further stretching it or pulling it apart. So your positive is going to be increased tilt of the talus or gap. So again, it's just going to be more movement on the injured side versus the uninjured side. You might have a lack of end feel, and then the person is also going to indicate pain specific to the CF ligament, and your pathology would be a calcaneofibular ligament sprain. Sometimes, too, if they sprain their anterior talofibular ligament, they will also indicate pain as well. Taylor tilt for inversion, this is a little video.
The Taylor tilt test is a test for calcaneofibular ligament ankle injury. This test is done with a movement through the ankle to stress this ligament. Tips are using the upper hand to stabilize the distal leg and cupping the heel in your hand while doing a supination and pronation maneuver to stress the ligament.
So I wanted to pause right there because he's bringing the foot into inversion. And again, if you can imagine CFL ligaments right here, you're just putting it on further stretch when you're bringing it inward. Right, next test, we're going to do Taylor tilt, but this time it's for eversion, so you're bringing the foot outward. Same patient position, so they're going to be laying on their back supine or sitting off the edge of the table. You again be in front of your patient, you're grasping calcaneus, so you're stabilizing above the malleoli, and then you're providing eversion stress. So instead of bringing the foot inward, you're going to try to bring the foot outward. And just know there isn't as much movement in eversion as inversion, so don't expect there to be like a huge amount of movement unless there's serious damage. And a big reason why is, again, you have that distal portion of the lateral malleoli that kind of blocks your ability from being able to roll it outward because this bone is longer than this one. Your positive is going to be increased tilt of the talus or gap, and then pain. And then your pathology would be that you have a sprain to the deltoid ligament. So remember, deltoid ligaments on the medial side, if you're bringing the foot outward, you're essentially stressing or stretching the deltoid ligament, which if you have a sprain, that's going to be painful. So again, another video.
This is the Taylor tilt eversion stress test, also the valgus stress test. You can do it with the patient's knee hanging off the edge of a table. You can also do it with their knee straight if they're pushed back a little bit on the table. You put the ankle in neutral position, being careful not to go too far into dorsiflexion. Okay, I'm going to grasp the calcaneus. Okay, let the forefoot rest on my forearm, and I'm going to stabilize just above there, and I'm going to take the calcaneus and evert it. Okay, or take it into a valgus.
So you'll notice there is not like hardly any movement, and that's probably because the person who he's examining probably doesn't have a sprain, but just know you're not going to have as much movement for the eversion test as the inversion. All right, very last test we'll go over is the one for tendon ruptures. So you have Thompson's test, which this is one of my favorite tests just because it's so easy to perform. But your patient this time is not going to be lying on their back. They're actually going to be lying prone. So that means that they're on their stomach. Your examining position will be to the side of the patient, and then you're going to have one hand over their gastrocnemius muscle, and then your action would be that you're just squeezing the gastrocnemius muscle and looking to see if their foot is plantar flexing. So again, plantar flexion is them, pointing their foot downward. So you're looking to see that it's basically just pointing downward. And so if you look at this image, you're having your hand across the muscle belly of your gastrocnemius. You would squeeze up here. If the Achilles tendon is intact, you squeezing is going to basically be like a chain reaction, and it's going to allow for this lever to cause the foot to plantar flex. However, if you were to completely rupture your Achilles tendon and you squeezed up here, you don't have that chain anymore, so that lever is basically disrupted and there will be no movement of the foot. So again, your positive is going to be no plantar flexion, so they won't be able to point their foot down. And then your pathology would be if they can't do that, then they have an Achilles tendon rupture. So last video.
It's got some amazing brightness. It's not distracting. It's not annoying my eyes. It is a world of difference.
Sorry for the ad.
The Thomas test is a test used to diagnose a complete rupture of the gastrocnemius muscle. So it's pretty simple. All you do on this is grab a handful of calf and you just give it a nice squeeze. Okay? If you see the ankle moving and plantar flexing, that's a good sign. That means
so you'll see that the foot is moving into plantar flexion by him just squeezing right here. If he squeezed right there and there was no movement, then that would mean that the Achilles tendon is ruptured. So anyways, hopefully that lecture and the videos were informative. We'll continue wrapping up the rest of this chapter tomorrow and Friday, but just make sure you turn in your notes by the end of the period, and I will see you guys tomorrow.